The randomized Phase III study, which is called the IMpactMF study, is a study it's an ongoing study of Imetelstat, the telomerase inhibitor, in patients who have refractory myelofibrosis, refractory to a JAK inhibitor. And they're randomized to Imetelstat at 9.4 milligrams per kilogram every 21 days in a 2-to-1 fashion, or best available therapy. And best available therapy does exclude a JAK inhibitor, but is physician selected prior to randomization. The point of this study is to determine whether there is a overall survival benefit of this novel telomerase inhibitor in patients who have refractory disease to a JAK inhibitor. The Phase II study, which was a randomized study looking at 2 different doses of Imetelstat, 9.4 and 4.7 milligram per kilogram IV every 3 weeks, demonstrated modest spleen symptom improvement, but encouragingly a survival of about almost 30 months in the 9.4 milligram per kilogram arm. And these are patients who were relapse refractory from JAK inhibitor, in which at least 5 different independent studies would suggest the survival is approximately 12 to 15 months. And Andrew Cockendale from Moffitt did a beautiful real-world data comparison with a propensity score matching that compared a cohort of patients at Moffitt to a similarly matched cohort of patients treated in the Phase II study with 9.4 milligram per kilogram of Imetelstat. And again, it replicated this finding that there was a clear survival advantage, at least twice what you would see with conventional therapies. So this data was quite encouraging. It is collectively what inspired this Phase III study. And I think it's an exciting study in general for the field because it's the first study that I'm aware of, and it's a registration study where overall survival is the primary endpoint. And I think we will learn a lot from this study. We will understand better the nature of Rux failure and whether modulating the disease and perhaps reducing the burden of malignant stem cells through telomerase inhibition can improve the survival, which is an important outcome, which is often overlooked because there's been a lot of emphasis on spleen and symptom for good reason. But this is a step forward in trying to improve outcomes in a different way. Enrollment is ongoing. This is a global Phase III, so it's a large study, many centers across the world. We're really looking for patients who've been on ruxolitinib, meet failure criteria, and can receive this drug. In some cases, this may be a bridge to transplant for some patients. Other patients, this may be definitive treatment. I think it's obviously an important study to move the field forward. So I would definitely encourage those physicians in the community that treat patients, if you see that the patient is perhaps not doing well, losing response to ruxolitinib, progressive spleen, symptom burden, consideration for referral to this trial, I think is really appropriate.